Can you guys hear me now? Yeah, it looks like I had my mute on. So hello. Sorry about that. My name is Ed. Every Tuesday, doing a BFR, answer questions, talk about some content, any new studies that come out. That's what I use this time for. So I like to start these off with questions. So anybody have any questions for me regarding programming, using BFR, how to use BFR, whatever those questions may be? You can go up to the upper right corner in the chat section and then just type your question in there. So questions go here. Everybody should have audio now because I'm seeing audio is working. Rob, Ben, are you able to hear me now? All right, so if there's no questions, then we'll just kind of get into a little conversation regarding, I think one of the interesting things is as we age, many patients tell me, like, I used to not have these problems before I turned 40, and then all of a sudden 40 hit, and I'm more sore, I have more aches and pains, I have, it seems like I can't do as much without kind of irritating or slightly injuring myself. And we have to kind of think about, like, what is it about the aging process that that doesn't allow our bodies to heal as quickly or as efficiently? Number one, I think, of course, compared to my high school athletes, growth hormone production way lower, testosterone levels way lower at my 47 years of age compared to when I was younger. And I definitely think that those play a role. Of course, growth hormone helps with collagen synthesis. The cool thing with blood flow restriction training is that it does spike your growth hormone. And it's one of the reasons why we will use blood flow restriction training after exercise as a recovery tool. So being able to use BFR post-exercise for recovery can be beneficial. Now, there are many different ways that we repair our tissue after exercise or after activity. One of the major ways that exercise-induced muscle damage is healed is through stem cells. And I'm sure you've heard me talk about stem cells before, but stem cells are the little repair mechanisms that we have. And these cells sit on top of muscle. And when we get these little micro damage to the muscle, these stem cells go down into that micro damage and share their nuclei with the muscle or tendon or whatever is trying to be repaired. They share the nuclei, so that nuclei can then be replicated, and the body will make more muscle cells or whatever type of cells you need to repair, tendon cell, muscle cell, whatever type of cell. Well, our stem cell production gets lower as we get older, and I think that that contributes as well. I also think we don't absorb protein as well, and protein are the building blocks. At least amino acids are the building blocks to muscle protein synthesis, or the remaking of muscle cells that have been broken down due to activity or exercise. So making sure that we have enough amino acids, or at least enough protein to have our body convert that to amino acids. BFR can contribute to enhancing stem cell production. BFR can also increase growth hormone. BFR and just hypoxia alone can help improve insulin growth factor and other things to help with the recovery and rehabilitative process. So I think it's interesting, and in our level 2 course, which I'm hoping to have, I've been saying this for a year, finally be able to release it. We're waiting to release until we're all cut up with our cuffs so that people can take it at home and get something out of it. But we will have these like pre-exercise, post-exercise BFR protocols that you can use to help with the recovery process. And then pre-exercise in order to prepare for the exercise using BFR and hypoxia. Annette says, I'm working with someone with low testosterone. His levels went up slightly over 2 weeks, not enough to change recommendations for meds. So that's good. It's it also depends on how they're getting their hormone replacement therapy. If they have pellets are slow release. If they're getting injections, then usually those injections have to be done weekly because they'll spike as the injection goes in. Let's say my injection day is Wednesday, Thursday, Friday, my testosterone will be elevated, then it'll start to drop back down again. And within about 6 to 7 days is when we have our trough, which is the low level, then you re-inject again, and then it goes back up again. So depending on how he's taking his hormone replacement can make an effect as well. And when they tested the blood and which testosterone levels, free testosterone, T2, whatever they were testing has to be consistent as well. Oh, he hasn't started testosterone. Oh, interesting. So he hasn't been supplementing yet, but he saw an increase in testosterone. Was he inactive, Manette, prior to training with you? Because I would think so he was inactive. So I would expect a spike just with exercise alone. So that's cool. Increased testosterone is not a bad thing. Okay, any other questions regarding blood flow restriction training right now that I can answer? I was just finishing up one of the chapters in the book. Book will be out. It looks like it's going to go to editor by the end of next month. So I'll have a whole section in there on stem cell production, insulin growth factor, heat shock proteins, other ways that the body adapts to blood flow restriction training. This microcirculation effect with vascular endothelial growth factor, other ways that our bodies can adapt to the to blood flow restriction and hypoxia in a positive way. It's very fascinating, at least to me. All right, thanks you guys so much. Have a great week, and see you next week. Bye for now.